our listeners to listen extremely carefully to every single word this extremely brave lady says.
Dear Brian, as you can see from a photo of my NHS ID to verify that I work for the NHS, can I please ask that you and UK Column not reveal my identity, my job title, or the health board that I work for, and as I am a senior nurse, it is appropriate to refer to me as such, but I really cannot afford for my health board to be revealed, as it would take no time for me to be identified, and I have already been threatened with losing my job. I report directly to the line manager, who sits at executive level within my board, and my card is already marked. I am directly involved with the vaccination programme for my health board at senior nursing management level. I'm essentially a policy writer, and I'm responsible for the prescribing documents that allow healthcare staff to administer the jabs. They are not vaccines, and as such, I can't refer to them as this. I have been in my current post directly responsible for all our vaccine policies and prescribing documents for years. I work in tandem with our public health team, and I know a great deal in regard to vaccines and their use. I have also worked previously as a research nurse, and I know how to critically appraise journal articles and trial protocols. I am contacting you at UK Column in response to the video No Smoke Without Fire Part 2, in particular concerning a question you put to Debbie Evans. You asked Debbie what she believed was going on in regard to medics, nurses and carers who were involved in the vaccine programme, and whether or not they had knowledge of the risks around the jabs, but were carrying on regardless, or were they not aware as a result of how they are trained nowadays. I would agree with part of Debbie's response in so much as everyone involved in the jab programme is simply listening to senior management, and there is very little, if any, questioning around the whole issue of the jabs. I started to ask questions in regard to the safety of the jabs before the MHRA gave their emergency use authorisation last year. I knew I would be expected to be directly involved in the rollout of the jabs in our health board, and I had been reading the trial protocols and their interim analysis data were published. I could see very early on that there were flaws in the design of the Pfizer trial, and for all the jabs, there was little to no safety data made available. I could see that the claims of the pharmaceutical companies as to the efficacy of the jabs was poetic licence, and as far as I'm concerned, was designed to mislead. Because my work has centred on vaccines for the last few years, I also questioned the speed with which these jabs came into use, and the fact that no one was questioning the outcomes of the numerous animal trials that had been undertaken over the previous 18 years for SARS and MERS. Initially, I refused to have any involvement and undertake my usual tasks in relation to these new jabs. However, I was quickly threatened with redeployment to the planned vaccine centre, where I would be expected to administer the jabs. I definitely did not want to be in a position where I was expected to inject anyone. So I reined in my objection, but continued to refuse to have my name appear on any of the paperwork. At every turn, I have challenged and questioned the need for these jabs in any cohort other than the plus 65 years and the clinically at risk. Even then, I questioned the lack of safety and efficacy data. I challenged the fact that our health board had adopted a policy of not providing the patient information leaflet, PIL, to all jab recipients. The PIL should always be made available to every recipient in a timely manner, so that they may read through it in order to make a truly informed decision and provide consent to receiving the jab. Yet it became policy that no one was to offer this to recipients unless they had requested it. However, lay people have no concept of the PIL and are unaware that this is supposed to be provided to them. Conversely, however, it is written in the protocols that the healthcare professionals must use to authorise them to administer the jab, that the PIL must be made available to the recipient. Similarly, I challenge the fact that the documentation used by the healthcare professionals as a checklist to be gone through with every recipient did not include that the recipient must be informed that they are taking part in an ongoing clinical trial. At every turn and where I can, I have constantly questioned and confronted my executive level line manager, my public health colleagues and my peers, some of whom I've worked with for over 10 years now. As a result of my non-conformity, I have been labelled an anti-vaxxer and conspiracy nut, even though both my children have been fully vaccinated, and I myself, whilst working clinically, had my hepatitis vaccination. I am not anti-vaccine at all. I have been excluded from certain meetings. I've been openly ridiculed and laughed at in others. And most recently, I was told I needed to watch my step, as when cost-saving measures are required later this year, I may just find myself surplus to requirements. So Debbie is correct. Those delivering the programmes and injecting the public are simply following the orders relayed to them, and for the most part they are doing so naively, in the belief that they can trust the rhetoric dictated by senior management. However, there is total awareness of the issues and risks involved with these jabs at senior level within the NHS, and not just in my board. I've spoken with colleagues from other health boards who report the same issues. When I last faced up to my manager, I asked why they were content to be taking part in what amounted to, as far as I was concerned, to genocide. Their reply was chilling and left me feeling both disgusted and despairing. They agitated replied that we all have a job to do and a part to play, and we need to just put up, shut up and get it done. It was made very clear to me government were leaning heavily on health boards to ensure not only compliance with the jab programme, but that the boards met the targets set by the government. Brian, I have tried to recruit colleagues to the cause. I've had numerous conversations with nurses who have years of experience working in the NHS and who are also aware that things simply aren't right, but always to no avail. I am often told that it's futile and there's no point in speaking up or speaking out, as they, being management, just won't listen. Then there are those who are aware of what's going on and simply can't take the stress of being involved. They have gone off work long-term sick in their droves. There are also very many senior nurses who have taken early retirement over the last few months, all of them citing the current situation with the jabs and the whole COVID debacle as the reasons they just had to get out. You mentioned, Brian, when talking with Debbie, and I have heard similar sentiment elsewhere, that those NHS staff who have knowledge of what's taking place and who are not speaking out are complicit in the atrocity. Some even go so far as to demand nurses like me speak out as a moral duty, and they have no sympathy for us if we end up facing Nuremberg-style trials. But I have a mortgage to pay, 2 young children and all the bills for the whole house to cover after my partner was made redundant last year. I can't go public. If I did, I would most certainly never work in nursing again. And with the current climate of unemployment, what chance would I stand of getting a job, never mind one that would pay enough to cover our outgoings and keep a roof over my children's head? I hate my job. I am currently ashamed to be a nurse, and every day I work for the NHS, I feel greater despair and loathing. You mentioned GPs specifically to Debbie, and I thought I would relay a conversation I had just yesterday with a GP at one of our surgeries delivering the jabs. The GP in question knows of my direct involvement with the board's jab programme and had questioned me in regard to the forthcoming Moderna jab that we are to begin administering in April. Through the course of the conversation, I learned that the GP had taken the Pfizer jab herself. Aghast, I asked her, was she crazy, considering the jab contained PEG, polyethylene glycol, also known as antifreeze. The GP didn't know the jab contained PEG. In fact, the GP didn't know any of the excipients in the jab at all, as they had never read the PIL or full prescribing documentation. I challenged this, stating that they couldn't fully obtain consent from their patients if they themselves weren't aware of the contents of the PIL. I then asked, were they informing their patients that they were taking part in a clinical trial? At this point, the colour drained from the GP's face, as they rather sheepishly replied that they weren't. They were simply asking if the patient was happy to be followed up over a 2-year period for research. In all honesty, Brian, the GP didn't even know the jabs weren't approved or that they were still in clinical phase 3 trials. Tragically, this GP's lack of knowledge in regard to the jabs isn't rare. Again, recently, I had a conversation with an NHS consultant who took the Pfizer jab. They too didn't know they had taken part in a trial or that the jabs weren't approved. Brian, if consultants, GPs, nurses and pharmacists within the NHS aren't aware of this, how on earth can we expect the public to know? Lastly, I disagree with Debbie on one point. She stated that she felt sorry for her NHS colleagues who were essentially being set up. I disagree. My NHS colleagues have forsaken their duty of care, broken their code of conduct, Hippocratic Oath, and have been brainwashed just the same as the majority of the UK public through propaganda and predictive programming. When I trained as a nurse, it was ingrained in me to question everything, to never accept being told because we've always done it, or because I'm telling you to. I learned that we were advocates for patients, and it was our duty to protect them at all costs, and I learned to look for the evidence behind every treatment or medicine I was to provide a patient. Therefore, I am complicit too. Although I know about the safety issues and have tried repeatedly to get through to management and colleagues, I have failed. I can't recruit a single NHS colleague, be they nurse, doctor or pharmacist, to stand with me and speak out. I have gone to the union to look for them to support me, but predictably they told me I had no real case and it wouldn't be worth pursuing. As a lone voice, I will not be heard, but would lose my job, 23-year nursing career and my nursing registration. Of that, I have no doubt. For now, I am resigned to remain in my post. I will continue to be defiant and to challenge everyone at every opportunity to try to wake them up and see if they would be willing to side with me. If a time ever came when this genocide came to light, and if I ended up on trial testifying against those in positions of power who could have affected the outcomes, I would not hesitate to give evidence. I will also accept my fate should I too be found to have been duplicitous in this horrid act of human annihilation. I do not fear that day, Brian. Indeed, I pray for it to come.
Well, what just an incredible statement by that extremely brave lady. And of course, she raises a great number of points which the public in UK should be clamouring at every single